Hello, I'm Richard Mohs, the Chief Science Officer for the Global Alzheimer's Platform Foundation. I'm very pleased to be able to offer my congratulations to those of you at Neuro-Bio, the founders, the staff, the financial backers, and all the collaborators on the opening of your new facilities. It's been my privilege over the past several months to really learn about the very promising work that Neuro-Bio is doing to develop a new and very promising approach to the therapeutics of Alzheimer's disease. The past several years have been very difficult for those of us in the Alzheimer's disease field. We've seen great advances in our understanding of the pathology, the genetics, the natural history, and the clinical progression of this disease, and yet the search for new treatments has been painfully slow. Many companies have tested molecules that target either the clearance or the production of amyloid beta, which is one of the key proteins that's involved in the pathology of Alzheimer's disease. We've seen molecules that have very potent effects to diminish the production or increase the clearance of A beta, and yet they have had no clinical benefit when tested in very well done clinical studies. It seems very clear that other approaches will need to be pursued if we're going to have some effective treatment for this disease. And Neuro-Bio is pioneering one of the most promising and possibly the most promising approach to the new development of treatments in this area. The identification of T14 as a key feature of brain development and one that seems to be reactivated in the presence of neurodegeneration offers a very promising novel target for Alzheimer's disease. The fact that T14 binds to a subset of cholinergic receptors links this new mechanism with one of the fundamental pathologic features of Alzheimer's disease, namely the loss of cholinergic function. This linking of a functional group of neurons key to memory formation is very important as it builds on the known science around the neuropathology of Alzheimer's disease and the known science around brain function and memory formation. The progress that Neuro-Bio has made in developing NBP14 and related molecules as therapeutic candidates is very impressive scientifically and offers hope to the many patients who are waiting anxiously for new treatments for this disease. Clinical development of disease-modifying medicines almost always requires concomitant development of biomarkers, both for the selection of appropriate patients and for the measurement of pharmacodynamic effects. This allows us to do informative studies. We then can be able to identify patients who actually have some of the pathologic features that we hope to treat, and we can use those biomarkers to identify appropriate doses that have the pharmacodynamic biologic effect that we want to use. This really shows that the approach that Neuro-Bio is taking, which involves both the development of a promising new therapeutic target, the development of potent ligands for that target, and the attendant biomarkers that will be necessary for scientifically appropriate clinical development, is incredibly promising. Please accept my congratulations to all of you who are there today to witness the opening of this new facility. And congratulations on the work that you've done, and you have my very best wishes for success in the future. Patients are waiting, and the field is waiting for new advances, and the work that Neuro-Bio is doing offers some of the most promising work that I have seen in a very long time. Thank you very much.